Are you guys already?
We are, so.
Okay. All right, we're gonna go ahead and get started. I'm sure a few people will continue trickling in, this morning, but, so this is Kevin Alvarez, and I'm sorry, Nikki. Okay, so Kevin, received his undergraduate music therapy training from the University of Pacific in Stockton, California. Following his graduation in 2014, he relocated to the East Coast where he completed his clinical internship at the Wildwood School. I don't even know how to say that. Schenectady, okay. Schenectady, New York, serving school-age children with autism spectrum disorder as well as other neurodivergent needs. Since completing his internship, Kevin has provided music therapy services to children and young adults diagnosed with ASD, cerebral palsy, Rett syndrome, Down syndrome, and other diverse neurological needs. He returned to California in 2021 to complete his master's degree in music therapy and later moved to San Diego, where he's been working as staff music therapist at the school, IEP-based music therapy coordinator at MusicWorx, a local music and wellness-based practice. With his nearly 10 years of experience as a board-certified music therapist, Kevin strives to use music as a tool for individuals to express themselves in a way that represents them at the moment, especially when they cannot find the words to do so. And without further ado, here's Kevin.
Yeah, hello everybody, very excited to be here, and I also have to thank my colleague Nikki for kind of helping me out because I'm a little one-armed bandit at this time. Long story short, I'm an avid dodgeball player. I was playing in a dodgeball tournament a couple months ago, and I just threw the ball a little too hard. Just gave myself a spiral fracture. So we are on the mend though. We are on the mend 12 weeks in. So hoping we get this out soon, but it has definitely been an interesting way to relearn new instruments that I didn't really know, like going through practicum work and music therapy training and having amazing colleagues who will kind of help you out on presentations like this, which is very, very exciting. So yeah, so my name is Kevin. As Lindsay said, where I work at MusicWorx, as is Nikki, and we are primarily located down in Toronto Valley, but we travel throughout San Diego County, providing music therapy and music wellness to individuals, huge spectrum. So I primarily serve students with special needs in the school, as well as with the San Diego Regional Center. I know Nikki works with mental health and with teens, adolescents, adults, and we also have colleagues who work in the hospitals, geriatric day homes, day habs, daycare centers. So really the whole gambit, and we'll go into a little bit more of music therapy as a scope of practice, but we just have a general outline for today. We're going to talk about what is music therapy. Let's talk about the rationale and how it is evidence-informed and evidence-based practice. So we'll talk about what types of service when we're talking about school-based sessions and working with kids, what kind of services can we offer? So some of those include individual services, group services, consultation, as well as family services. So this session, this first part will really be a lot of informative, I don't want to say lecture, but more a presentation of what is music therapy, how can you access it, and then our latter half, we want to invite the kids to come back in so they can really have this experiential moment. We have lots of instruments and interventions and songs and movements that we want to present to you, and how those are addressing some goals and objectives through music therapy and through these music-based interventions. And then we'll talk about, so we'll also do some therapeutic aims, so we'll give you some sample goals and objectives, and then from that, we'll go into these interventions. What does that look like? And please, I'm also one of those presenters that doesn't mind questions as we go. We have a lot of time here. I don't want us to feel rushed, so if you have questions, please feel free to ask. All right, so let's talk about, so what is music therapy? So music therapy, as we see up there, it is a clinical and evidence-based use of music interventions that will accomplish individualized goals within this therapeutic relationship by a credentialed professional. So both Nikki and I are board-certified music therapists. In order to have something be called music therapy, you need somebody who has completed their 1,200-hour internship, as well as all their practicum work and their undergraduate coursework within their accredited university in the United States. As I don't know if there are actually any international places.
For accreditation?
No.
Yeah, I mean, I think there are, the MTBC I think is accepted internationally, but also there are different
Yeah,
like
like-
EU has, I think.
Right, like a
Different
different
accreditation.
corresponding to what nation you might be in, so yeah. And the United States you definitely need your MTBC to practice and call it music therapy. So some of these goals that you might see, we might promote some wellness, manage our stress, alleviate our pain, express these feelings, enhance memory, and so on. And some of these are just some goals. You know, the scope of practice is so wide, and all these goals are going to be tailored to the individual to meet their needs. We'll go a little bit more of what that process looks like, but essentially what we do is once we get a referral or once someone asks for music therapy, you're kind of going in and you're doing this assessment. How does this person use music already? How is music going to impact them or help them improve a certain skill or decrease maybe maladaptive behavior or these maladaptive stressors or anxiety? And will this really promote this wellness in this individual? So those are really these are these parts, because everybody enjoys music. Yes, we know that. But how is music really going to impact their learning? And are they going to connect with music in this therapeutic way? And that's our job as music therapists, to know how music will affect us, how it's going to affect our brain, how it's going to affect our movement, how it's going to affect our learning, and create a session plan and a treatment plan that's really going to help improve the wellness. So this really, what does it look like in the classroom? And I want to put a caveat on here. This presentation is really more geared towards a school-based session. We can talk about what that will look like outside of the school, what the access to music therapy is like outside of the school. So just, I want to put a little asterisk there that this is more towards the schools. Yes, question.
Like, okay, I'm basically a counselor and I'm using music for emotional connection versus this music with this rhythm, with this beat changes these parts of the brain, and therefore I'm using music as a therapeutic intervention. Is that all music therapy, or is there a language you use to differentiate?
Could you repeat the question?
Yeah. So essentially what she's asking is, as someone who's not like a music therapist, but we're using music in a type of therapeutic way, what is the difference between using music not therapeutically or using characteristics of the music to address these certain aspects? Is that essentially what you're asking?
No, we don't like to find, say, some music has an impact on Alzheimer's, but it has to be certain types of music.
Yeah.
But that's very different than saying, I'm gonna have a kid play a musical instrument in a way to connect emotionally, right? It's the biochemical of the brain versus just the emotional connection.
Correct. Yeah, that's totally right. So she's saying, does like the qualities of the music is going to connect differently than somebody who's just as a child who's just going to connect emotionally. And yeah, and we'll talk about that a little bit more. There are a lot of research shows of how the different qualities of music is going to affect our connection both with music therapists and as also the results with our interventions. And they're, working with a kid and working with Alzheimer's is also like very different. It's going to talk about what are we focusing on in general. Do you want to add anything else?
Yeah, the goal is basically shape the intervention. So it looks different for every population and setting, and even within a population, depends on the person. So we'll get into some specifics about how that might be organized.
Yeah, and I mean, one example that I always like to use, it's definitely going to look different for every person. Music therapy isn't this one fix all kind of a thing. There are some people who may not enjoy this pop music. Like even with one group setting, really kind of look at what is the consensus of the group? What is the cohesion like of the group? And how do we adapt these preferred songs and to address these goals, right? So music therapy is really focused upon using the best available research, the clinician expertise, as well as the preferences and the requests of the client to really promote those goals, promote those changes and improvements within those goals. So as music therapists, we really understand how music will impact the behavior and elicit these certain responses and engagement from our clients. And one of my favorite examples to use is, I'm coming into this classroom of, let's say preschoolers or young children who are they have a lot of high energy coming in from the playground in the classroom. And you would think, oh, let's put on some calming music to like get us ready to learn. Well, we actually want to like match that energy, right? So the music therapist is going to play this high, really enthusiastic kind of music that matches their behavior. So if they're kind of running around the room, let's play some fast, get them engaged, get them connected to that music first. And then as the song progresses, the music therapist is really going to manipulate or change that playing style to kind of bring our behavior down, get us ready for learning. And as we slowly start to bring that down, we're getting ready for learning, we're optimizing our transitions and getting readiness. So we're calling this the ICO principle, right? So this is this technique which music is matched within the mood of the client to then gradually, gradually alter the effect of the desired mood. So bringing us from this highest point of where we are to bringing us down so we're ready to learn. And that's essentially how we're going to use music to manipulate our style and manipulate our learning to get us ready for transition. Yeah. So music therapy and special education. These are just some, there's tons of research out there of how music is beneficial within special education. Our first one here really talks about how, children and young people with severe and profound intellectual and multiple disabilities, how they use music and what are areas that were impacted by the learning. So they really focused on social and communication, and those social and communication domains. So they use a lot of active music therapy techniques. So movement, instrument playing, large group games, those are all super active music therapy interventions. So what they found is that when let me go back for a second. When they're interacting with a partner, we're allowing time for listening, for turn taking, waiting for pauses. So those essential things for those social skills and communicating with somebody else. Your turn, my turn, waiting for response, time for you to interact. And then there was also, through these partner interactions, a lot of arousal, like levels of arousal and mood of engagement. So when we're singing these songs, super highly motivated through singing like their partner name and their name, and they were providing directions. So through these songs, we have a lot of embedded directions. What I like to talk about too is how when we're speaking, while we have this inflection in our voices, it's still pretty monotone. So it's easy for us to get, lack of a better word, bored when people are talking. But think about like when you're watching your favorite singer, or you're just entranced by this performance. Not only are you like looking at the performance, but when somebody has this insane vocal, you're like, oh my gosh, that was so amazing. I want to listen to it more. It's like literally like your brain is just firing off like these neurons, like, whoa, I really like that. I want to pay attention to that more. I need to know, like, your brain is just like accessing that outside stimulus to focus a little bit more. And so because these songs are, why did it get so dark? So these songs are, because music and songs are so naturally repetitive and predictable, we can really connect and anticipate these responses. So even if we're singing a new song, we can really know what's going to happen next, so we can fill in the blank with that lyric. Or we can know when we're going to pause at this moment, whether it's the structure, the chord structures, the tonal center, if there's like a change in the music. It's also why key changes in songs are so amazing, because you're just listening to this song for a while, and then there's this like kind of subtle, or some of them can be really extravagant kind of key changes, and you're like, that sounds different. What happened there? Really, again, your brain recognizing there's a change, I'm invested in this. And that's why music is so impactful when we're learning new skills or trying to improve upon these skills. And so because music has been so repetitive, that the child could participate a little bit more and anticipate these responses and providing like a greater chance of learning that skill. So I want to move on to, so some of these are just tons of great research out there of how music therapy impacts our learning, impacts our development, and these are just some snapshots of what it looks like. So common goal areas. Again, these are just some goal areas that you can address within music therapy. So music therapy has really been used in special education to really work on communication, our interpersonal skills, so our cooperative play and our parallel play, both working with somebody and imitating somebody else. And personal responsibility, so that's that self-regulation aspect. So if we're really having this high moment or this high out-of-body experience, how can we access this music to get us back into this sense of readiness, sense of learning? How the music choices that we make, or or the music that we pick really helping us regulate ourselves. Music therapy has also been used to work on gross and fine motor skills. We're gonna be doing a lot of that gross motor today, whether it's dancing, playing instruments, or more of those fine motor skills. So we might use the piano or the guitar to work on our dexterity within our fingers, or we're having this motor skill, we're imitating gross motor movements, or we're sitting in one place and then we isolate one body movement or do multiple step movements, so that not only focus on gross motor, but also direction following. As well as like academic and cognitive skills. So within the schools, it's nice to collaborate with teachers and staff. So there's this carryover from the classroom and from to the therapy setting. So identify what are the needs that what are the greatest needs for the child, and how can you carry this over? And so we have this nice kind of essential seamless transition. So what we're using in the music therapy setting is also going to be used in a classroom setting. So we have slowly kind of like take out that music part, so then they can use that in an everyday setting. Additionally, music therapy has really been used to promote learning and skill acquisition. So counting, letters, rhyming, all those essential like pre-academic to academic skills. Music therapy can really help in that development. So we're learning this social competence. So learning these social skills, as we said before, taking these turns. I say something, you say something, waiting for those responses or waiting for those pauses in a conversation. And that can really help through like instrument play or taking turns of singing certain lyrics. We're going to enhance our emotional regulation, reinforce this academic and cognitive function, and also build confidence and independence. Because music therapy is really focused on this relationship between the client and the therapist. The client has really created this environment that is very successful and also a little intimate in the way too, where it's just like this person may not have a lot of interaction with like music on their own before. So now there's this place of exploration, and now they can find themselves, they can find this connection with this music through somebody who can facilitate that relationship.
I just want to speak to that real quick too. A framework that I learned that I really recognize, identify with, is music as co-therapists, where we're using the music as the projection, as the holding container to be that like in between. So it's this intangible vibration, literally, that we are working together with to create something new and different. And that is so much different than even a physical object in front of you, just like playing, like just drawing with art or something, or just using words. The music is ever changing and ever moving and like constantly in touch with us. So that allows the client, the kiddo to really just be a co-creator in the space. It's not just that therapy is happening to them, they are creating in tandem with the therapist and the music.
Yeah, it's really fascinating too, because it's so easy for us to turn on the songs if we're having a really difficult time, and then if it's maybe not helping us, we'll just turn it off. Through this music therapy, I think it was saying, it's because it's so fluid, we can really kind of let the client lead, and then we adapt it when we're using our live music, guitar, piano, voice, anything like that. We can adapt it to their needs right in the moment. And that's what makes it so impactful and so important, is being able to really facilitate that growth and experience. So I just want to, before we get into some of the services and how do we get these services, let's talk about some examples of these goals. So when we're talking about academics and cognition, some of these immediate examples you might think of, we're using these songs to help with counting and number identification. So these melodies can really help with memory and sequencing. So think about your mnemonic devices. If you need something to remember easily, you're going to think of a mnemonic device, put it to a melody. A lot of times in my work, you can use some of these familiar songs and then just like change the lyrics to help remember something. And then it's music as advanced as music is, it can be so simple in a way. And fun fact, I don't know if people know this, but the melody to like the ABCs, it's actually 3 songs. Do we know that? So like you have the ABCs, so like A, B, C, D, E, F, G.
Yeah, Twinkle,
Twinkle, twinkle, and then there's one more, and then we know the third one. They have ABCs, Twinkle, Twinkle.
Blah, blah, blah.
Boom, bottom line. So 3 completely different ideas of what you want to present, but the same melody is used. And that's, you know, in a simplest form, that's how you can use music to work on a specific skill, especially if clients are really have certain songs that they really, really enjoy, but you want to teach it or help them learn different skill. Use those preferred songs, but change the melody and change the lyrics to present the skill in a new way. So to address like some of these motor and social skills, let's work on instrument play. So these can be used to meet those fine and gross motor skills and those social emotional needs. So students will be able to learn by turn taking, by choosing a peer, passing and relinquishing these instruments, and also just exploring these different things with a set of people. At first, we may not acknowledge our peer, but when we're kind of asked to, okay, now choose a brand or choose a peer to pass the mallets to or pass these instruments to, we're working on those social skills. Or when we're playing with somebody else, we have to imitate what they play or play what they play. Really acknowledging somebody else, waiting for that pause, right? Working on that co-communication. More movement. We're talking about like these guided movement and structured dance. We'll do a lot today, so I hope you're ready to move and groove today. We'll do a lot of dance, really increases its range of motion, your body awareness, as well as some self-regulation. We haven't really talked about it, but let's talk about our internal rhythm. So when you're listening to music for the first time, whether it's in the car or you're getting ready for the day, do you ever notice your body either your foot start to tap or your head start to bob or like you're kind of swaying to the music? Again, that's just like your internal rhythm kind of grounding yourself into this moment. And that's our job too, is to really create this environment through our modality, whatever instrument we're leading with, to create this really grounding effect for our students to focus, or for our clients to focus, engage, and interact in this musical moment. So the next time you're kind of, it's gonna take away from like the authenticity of the moment, but like, think about it the next time you're listening to the song for the first time. Does your body do kind of something spontaneously? That's kind of just like your brain, your neurons like, I love this, I really, really like this, I want to focus on this. And then it's really going to help us regulate ourselves, bring us back to the state of learning. And it's just fascinating to me the way the music is impacted by the brain, or the way the brain is impacted by music.
Yeah, physiologically, our heart rate, our breath rate, do what is called entrainment. So it entrains to whatever the frequency or the rhythm that is happening around you. That is why people have euphoric, otherworldly experiences at concerts. Everyone in that room, in that facility, is synced up together in some phase, in some capacity. So being able to share those phases, share those vibrations, that like is a further amalgamation of why music is co-therapist.
Yeah. And then lastly, when we're singing these preferred songs, it really encourages this vocalization and support our communication needs through spontaneous singing, working on our rhythm of speech, working on our clarity. So all of these are some snapshots and some goals that we can work, some skills that can be worked on through some music interventions. All right, so now that we kind of have a background of what music therapy is and how it can help us and impact us, let's talk about what other types of services. Oh, you can't see the white, but it should say our top one is individual services. So what are individual services that, the music therapist will implement this treatment plan that focuses on the individual needs of the client. Usually these are higher needs than you can get in a group setting. These are almost like baseline skills that are needed before we can like go into a group setting. So working on regulation, social skills, sharing, all these different kind of things that we may need before we go into a group setting. And I do want to note that not every student is going to benefit from music therapy, and not every student really needs music therapy. And we recognize that through the assessment process, which we'll talk about a little bit later. And it's really important if you feel like your child likes music, that's great, that's awesome. But what specifically about music do you think impacts their learning or impacts their development? That is something that an approving provider will need to know. will want to know. That's going to strengthen your case to either receive music therapy or at least get an assessment. In a group setting, these are mostly used to improve our social skills and our group cohesion. We can really focus on these goals that cannot be addressed in an individual setting. So if a person just really needs to work on a lot of these social skills and improve their interaction with peers, maybe a group setting is more fitting. And these are usually between at least 3 or more individuals in a setting. So in family services, these are great too, because this is really, you work at the collaboration with the family. You're gonna collaborate with the family to develop a program that best supports the needs of the individual outside of the classroom setting. So the music therapist is really acting as a coach and to teach the parents and caregivers specific music therapy techniques and strategies that they can implement at home. So you might, once a month or once a week, however the plan is developed, the music therapist is going to teach these specific music-based strategies and techniques. While I think it's important to recognize that as caregivers, we may not be as confident in our music skills as somebody who has been doing music their whole life, pretty much. We're gonna go away from that and we're gonna focus on the delivery of the intervention. So the music therapists really work with the family to develop the music, whether it's a playlist or a specific skill or recording that the family can facilitate when the music therapist is not present. And similarly to the family services, our last one is the consultation services. So again, the music therapist acts as a coach and a mentor to the classroom staff, to the facility, to whomever is receiving these consultation services, to promote these music-based strategies to the staff when the music therapist is not present. So similar to the family services, they will coach the staff on the delivery of their services using the identified goals and objectives that the team discussed. The difference between the family services and the consultation services, the family services is working like in home with the family. The consultation is you're working with the facility, school, daycare. That's kind of like the difference between those. All right, so we talked about types of services. In the schools, let's talk about receiving services. Oops. Okay. So let's talk about receiving services. So the purpose of music therapy services in a special education setting is to help facilitate those functional educational outcomes in the IEP goal areas, such as like academic learning, communication, social skills, motor development, behavior, and these daily living skills. When we talk about what is this process like? So if we're going to determine our interest, like we said before, everybody can benefit from music, but what are specific characteristics? So let's think about it. So determining our characteristics, here are maybe some guidelines we could look at when you're thinking about if you want to add music to your child's IEP. Does the student, or can the student's IEP goal areas be functionally supported through music therapy interventions? So that's more of, asking music therapists, like, what do the goals look like? And can music-based interventions address these goals?
Has most people here worked with IEPs? Yes, okay.
Thank you. That's probably.
Yeah, because then we can also see, like, if you wanna, shout out an IEP goal that that you're familiar with, we can also kind of role play like, oh, music could fit in here. So if there's anyone that has like, oh, this is the IEP thing that we were working on for my loved one, and yeah, let's do it.
Turn taking the conversation.
There we go, yeah. So
Classic drumming.
drumming,
Yeah. It's a huge one. I don't even bring my big drum, but we have, like this simple, just like, we'll play something, pass it to the child, and they play something. And then once you find that baseline has either like succeeded, then the next step is just like, oh, let's introduce a peer. And like, can they take turns with the peer? Can they on their own, the first step might be like the music therapist facilitated play and stop. And then maybe once they have achieved that goal, now we're just like, let them guide it. The music therapist is just providing the background music. And then having those interactions, can I pass back and forth? Yeah. Okay. Yeah.
Another.
Yeah.
Repeat the question.
Yeah, so she was asking, and once they kind of achieve, like, maybe in a dyad group, like just two people, can you add more people into the group? And definitely, we have like these different benchmarks of what do we want to see and what do we want to improve. So we're adding those different groups and like the goal to come into a group setting, definitely. Yeah, and then I saw him back there, yeah.
Are there specific wording of goals that tend to lend themselves more towards the introduction of music therapy? As opposed to like us as a parent saying, oh, I think music therapy could be this year, putting a goal, like actually putting a goal forward, they're like, oh, we handle this via music therapy.
Yeah, so the question was, are there specific, like, is there specific wording or phrasing we should use during like these IEP meetings to get music therapy on the IEP? I think I have a slide that really talks about specific things you want to bring to like the IEP team that, you would see, but essentially, yes, there are. So, like one of the determining characteristics is like, is music a documented learning strength for the student? So if you have maybe a student who can't express himself verbally as much, when their favorite songs are playing, do they have more communication, clear communication? Any of those lines, they have increased language when music is being played. That's a good indicator that they should get a music therapy assessment. If there's a student who's maybe has a lot of behavioral challenges, when music is being played, do they have a decrease in those behaviors? That's another good indicator that maybe they should get a music therapy assessment because really music has been helping them decrease those maladaptive behaviors or those out-of-body experiences. Another one of my favorites too is like if you have a student who just has a lot of energy and needs a lot of support, when music is being played, can they really just settle in, right? Going back to that entrainment part. If they're able to kind of facilitate more of their independence through music, that's another good indicator that music therapy would be a great, at least an assessment is needed. So, the second part of this was, that I wanted to point out too is that there are a lot of, is additional support required to address these relevant goals based on factors such as flow or insufficient progress? Have there been interfering behavior or a limited number of instructional approaches? So it's almost, I think a good indicator too is like you've had speech therapy, you've had OT therapy, you had all these different therapies and you're really not seeing a lot of progress or there's just something missing. That could also be an indicator of music therapy. If music has been benefiting the child in the past and it responds really well to music, that would be another good indicator that like, I just don't feel like our current plan is benefiting them the most that they can. However, my student or like my child really excels when music is being used in some capacity. That's another good indicator of how music therapy should be, or should at least an assessment should be done. And then the music therapist can come in, provide the assessment and give their findings. And again, personally, I would love to give everybody like music therapy. I think everybody, yeah, but then there are times when you just see in this more structured setting, it may not be a huge benefit or at least direct services. But that's why all these different kinds of services are provided, right? Consultation services, family services, whatever those may look like.
And just to add on to the like specific wording of the IEPs and when you're up for review and considering what therapies might be most beneficial for your person, music addresses cognitive, social, physiological, psychological, every domain pretty much. So as long as you have things within the IEP that do interact with those components, the music therapist will be able to like function some goal in music therapy language towards that. At most 3 to 4 tasks on 3 to 4 like music therapy goals per IEP. It doesn't need to be everywhere. But yeah, to be able to open up the opportunity for the music therapist to fit in, I would recommend making sure that there are like social and emotional regulation and communication. Communication would be probably the biggest domain that would warrant music therapy to weave into the IEP.
Okay, so I want to go ahead and we'll move on to steps for services. So what is that going to look like? So we mentioned So at your IP meeting or at a annual review or maybe a 30-day, 90-day, 60-day, you say, I'm interested in my child. You know, music has been really impactful. I've seen X, Y, and Z happen when music is being used. So you can ask like, can we get a music tech assessment? And under IDEA, they have to like grant the assessment, right? If they be like, oh, like we don't have anybody in the area, like that's not true. There are tons of resources that can be used and identified to find your music therapist to provide this assessment. I mean, let alone San Diego, there's 3 practices. So if you're from the San Diego area, you have opportunity for a music therapist. So what does it look like? You ask for that referral. So the school receives that request for music therapy and for the music therapy assessment. So then they'll reach out to the music therapist and the IEP team will determine that a music therapy assessment is appropriate and they're going to develop this assessment plan. What does the assessment look like? Essentially, what the assessment is, it's the music therapist is going to review their IEP and any other educational records. They're going to receive staff and parent or caregiver input. The music therapist will observe the child, the student or the client in both a music and a non-music setting. So the music setting is the music therapy assessment. The non-music setting, I usually ask like teachers, like when is the student having the most difficult time in learning? That would be the time to come observe. Sometimes you just observe for a couple hours and it's, you know, you'll see different aspects of their learning process. And then after they do the observation, they'll conduct that music therapy assessment, and then they'll identify the important part of reviewing the reviews, like the IEP, is so they can see which goals really fall within the music therapy scope of practice. And our scope of practice is pretty wide. However, it's nice to kind of see 3, 4, 5 goals when you're doing an assessment that really align with the music therapy scope of practice that you can address in an assessment. Yeah.
So does the child have behaviors that require intervention anymore on the behavioral side? And we see kind of a lot of that at home.
Sure.
So is it something where the IEP team is going to need to be, like, they're going to say like, oh, well, there's no behavioral issues here, so we don't need to add anything? Or is it one of those things where if you request it, they have to reply and do this within a certain amount of days? Like, are they legally bound to do that regardless of whether it's accepted?
I believe, yeah, let me check my notes here. We have so it's, you know, music therapy is protected under related services. So I think they are obligated to at least try the assessment, even though it's not seen at school. You're like, this learning is really being impacted. We really think this is needed. Can we at least do an assessment?
And it doesn't necessarily have to be behavioral based, right? It could be communication, that they communicate more clearly when they're using music, taking turns.
Yeah.
So it doesn't have to be behavior only.
And
Yeah.
are they under the IEP, where they are, like, they have to do it at a certain amount of time?
I don't know about a certain amount of time, but they definitely have to, if you request it. Yeah, I wish I had like the exact part of IDA. I could probably find that in the presentation, but yeah, like it's under that. It's as a related service. You know, if all of these things that have been addressed aren't working, music therapy can be like that supportive service as well.
And if it's determined that the child needs it, is school required to provide it?
Yeah, from the assessment, the music therapist is, I mean, it all depends on like, does the school agree with it, right? So they're gonna, you know, those meetings, right, it can be very, very challenging. And, you know, I recently had this experience where, you know, I found that this child really, you know, during their assessment, one redirection was needed in his 45-minute assessment session. During his 10-minute academic activity that he was doing, he needed like 10 redirections. And so I put that in the report, and then I told the school, I was like, so while yes, the student has been receiving like, you know, this group consultation services, yes, they benefit from it. That's not my recommendation. My recommendation is the direct service model. So really showing that evidence and showing why it's so needed, and it can be frustrating, and I totally I like empathize that it is very frustrating because music therapy it's not new, but it's not as been around for like your traditional speech PT. Really working with like that therapist. And I do want to point out too, although you may not be able to get it through the school, I would reach out to like your local like regional centers. Are you from the San Diego area? Ellen? Okay, so in San Diego, we have the San Diego Regional Center. So the regional center provides families with individuals with disabilities different types of resources and therapies. So they essentially provide them with one medical therapy and one non-medical therapy. Music therapy is a non-medical, so that is also something it's easier to access. So I would also recommend if you're having troubles within the schools, look into like local agencies outside the schools and see if music therapy is an option. Yeah, hopefully that helps a little bit more, but they need to honor that request because, you know, it is that, and once the team determines it is necessary, I think also that wording to making sure the music therapist not only says it benefits, but is necessary for their learning. Because it's gonna be like, sure, like that's benefiting, but like there's no evidence that you said it's required. So language is very, very important. Good question. Yeah. Cool. All right. So yeah, so after we do that assessment process, you know, music therapists, they have the assessment process following that parent and that caregiver approval. The music therapist presents all the assessment findings at the IEP meeting. And if it's determined that music therapy is appropriate, we'll talk about what service, direct service, consultation, or collaboration services will be added to the student's IEP. All right, so I'm going to pause here for a second because these are all different kind of interventions that we have. But I want to invite you to, if you have your child, if they're at childcare or next door, I would invite you to go ahead and have them come in because we'll have some experiential kind of moments. So you can kind of see this impact coming. So we do have some tambourines on the table. Once they come in, they can grab a tambourine. We're also going to pass out some scarves. And I know you can. All right, yeah, so well, I invite them in. And because, you know, I could talk to you for hours and hours and hours about how great music therapy is. I'm a little biased, but whatever. But I think you should be able to kind of see it and how you can use everyday songs or familiar songs to really address these kind of goals.
Can we just get a show of hands? Who has experienced music therapy before for themselves or other people? Yeah. Just a few. Okay, so it's not something you've seen in person? No. Okay, cool.
And I guess I will say this is a very loose structure of what a session might be. So with a grain of salt. And I also kind of just ask you to kind of just embrace this silliness, embrace this moment, because that's how we get the most out of it again. So do you have a question?
My name is Malia. My name is Malia, but like Hawaiian,
Milo Princess. Well, Leah, thank you for letting us know. and Thank you for being here today.
He wants to.
Yeah, question. I you can't really call it music therapy because they're not music therapists, but they have like this structure that will address those goals. It's like a music therapy test. Because they're not tortured by music therapists. Yeah, you know, they have very Rachel, you know, or Jack Hartman. Yeah, it's not necessarily music therapy. All right, come on in, everybody. Grab a tambourine. When you're ready to say a little hello. Hi, you want to be? Yeah, why don't you go ahead and take it? Okay.
What's right here?
Yeah, here, buddy. Oh, yeah.
I don't know, it's not all the way around.
There's a name from online. that wants to
Keep passing it around this big.
Yeah, yeah. We have kind of
I know how to show fonts.
What's your name? What's your name?
Amelia.
All right, Leah, Amelie. Yeah, we are. Yeah. All right, are we ready to say a little hello?
Ready? Let's hear those instruments. We got tambourines, shake 'em, shake 'em. That's right. I'm in for music.
Hey.
I'm in the mood for music. Very good. How about you? I'm in the mood for music. And how about you? I'm in the mood for That's right. Who do we have up here? What's your name? Maria is you and it's time to sing and go. Hi, Maria. Maria is you and it's time to sing.
Hello.
All right, guys, I'm gonna make you dance a little bit. We got the circle. We got I'm in a mood for music. Very good. So it's always nice to open up with a consistent song, create the container with that same frequency. That way the kid knows, okay, music time, we're getting into it.
Right, so our sample goal here is we're gonna increase expressive communications. We want to be at least 3 conversational exchanges. That's a hello, a verbal hello, a wave, eye contact, hi. Any kind of this conversational exchange, we're gonna include that, and you heard how it's embedded in that music, you know, so just say like, Kalia's in the mood for music, or no, what'd you say? Oh, Kalia is here, and it's time to say. Boom, you got one right there. So as you know, music is so repetitive, you're gonna get that interaction. All right. Now that we're warmed up a little bit, we're gonna do some fireworking today. So I got some scarves here. Just for time's sake, I hope it's okay if we just throw some out here and grab a scarf and find a little space on this floor to do some dancing, to do some moving. All right, scarf? Scarf, you want to? Scarf? Probably I have it. Scarf? Sure.
Got some
There you go.
He wants to be up there.
Wait for that. It's on.
You ready to dance?
You like,
We'll find out. All righty, so you might want to find some space because we are going to work on those arms. We're going to pretend to do some fireworks today.
You want to come up here? You can come up.
Yeah, come up to the front, show us what you got.
We want to see it dance. You gonna dance with us?
All right. All right, are you ready to dance? All right, we're gonna dance. All right. So we'll do the free dancing. The only thing is, when you hear the word firework, you're gonna throw them up as high as you can go. So let's practice. Ready? It's gonna be like, cause baby, you're a firework. Come on, let your colors burn. Make them go, oh, oh, oh. And you shoot across the sky. All right? All right, let's do some dancing. Here we go. Ready? All right. Let's go side to side. Move that foot side to side. Move it side to side. Let's begin. All right, let's go down, down to the ground. And we're going nice and slow. All right, let's get ready to roll. All right, let's go up and down, here we go. Down. Up and down. Let's keep it going. After everything, the rainbow, baby, you go in a circle. When you come, we're gonna be the perfect one. Like a rainbow, every time we go. All right, let's go low, get low, get low. Nice and low. Up low. Up nice and low. Down. I got it. All right, we can make our way back to our seats. Right on. Woo! Right on. We can make our way back to our seats. Let's see, fireworks is all done. Now it's time to go sit. Thank you for sitting. Nice. You can go ahead and keep those cards on those tables there. We'll collect them when we're done here. Wonderful. So as you can see, while not playing an instrument, a scarf can be a fantastic object to use. You can throw the scarf and it has a very low chance of hurting anybody, which is amazing. So during a music therapy session, our student will maintain grasp on the instrument for at least one verse of a song. So that's really easy to tell. Usually verses are anywhere between 5, 7 seconds. So you can have that opportunity to, I know, like 10 probably. Yeah, so it could be, we're looking at that data, right? Let's take that percentage, or you have a certain number, in the chorus, we're gonna throw that firework 4 times. So they have to do like 3 out of 4 tosses to work on that movement, right? And it's not noted up here, but there are a lot of directions within that song. You have to go up and down. You have to go side to side. Throw up and down, go down low and get up slow. So not only gross motor, but also direction following, receptive language, imitation, all these certain type of skills you will find within these music therapy-based interventions. Great. Oh my gosh, anybody else out of breath? I'm out of breath. Woo! All right, we have one more intervention that we want to present to you all. Just raise your hand if you know the song Down by the Bay. Anybody know that song? Great. Well, you know what? We need your help. We don't know what some of these animals are called, so we need your help. So we need to see that animal pop up on the screen, call it out. Also, sing along.
Down by the bay.
Yeah.
Where the water goes. Down to my home. It's hot there, not yours.
If you ever see
Wow.
what is it? You know what it is? Where was the
Buffet.
Polka dot.
Where's that?
Yeah.
That's how we got away with polka dot tail. Down by the bay.
Down by the bay. Where the water goes. Back in my home. I cannot go.
If you ever see a bear, what is the bear doing? Oh, I'm back there. What is it? That's right, a bear holding a chair.
Where the water goes. Back to my home.
Did you ever see a, what is that? That is right. It is a box in a box. Is that right? Oh, sorry. Sorry. You said fly during the time? Oh, what is it? Oh, we'll take it away. Got it. That's right, I'm just going boats.
Down by the bay. Where the sun
Did you ever see us? Oh my God! What is that? Do you know? It's a move? What else is in there? What is it? A moose and a goose? Oh my gosh. Oh my gosh. Nice one. Right on, everybody. That is a small snapshot of what you might experience in the music therapy session. Of course, it goes beyond soccer stick, right? It's very, the process can be a lengthy one, can be a frustrating one. So once you complete it, get more. You keep it intact, right? This is a short, I don't know, 10, 15 minutes of what you saw of our kids' experience, and hopefully this gives you a little bit more information about music therapy, how you can advocate for yourself and for your child or for your individual. And yeah, my contact is up there too. So sorry, I ran out of business cards. But feel free to take any other questions. And I know, is there anybody from like San Diego County here? Oh, amazing. But we have, I'll put up here too. We have a whole resource of music, like a music therapist network that I just put up here for you too. Okay, real fast. Hi. Hi. I don't know if you can, you definitely cannot see that at the bottom. But this, that code down here is cbmt.org. That has a whole list of music therapists available from every state, that you could contact for any other questions as well. And they might be able to guide you in the right direction if they're not in your local area. But, yeah, we have a little bit of time here on your way out. If you have any other questions, anything, I'll be happy to answer them. Yeah. Yeah, the one. Yeah, but feel free to have maybe somewhere else on bags and you can take your stuff with. I also have up here what I did not show you. I'm so sorry, Karen, but we have some slide whistle and kazoo. Yeah. But if you want slide whistles and or kazoo, there's a reason why we brought them today, to get them out of our office.